Hello, today is Wednesday, December 16th. As of yesterday, there are 72 patients with COVID-19 in our hospital facilities. 13 of these patients are requiring critical care in our ICU. We're happy to see these numbers improve a little over last week, but they are still very high, especially the number of patients in our ICU. For the week ending Friday, December 11th, the positivity rate is at 18.5%. This is still very close to our critical threshold of 20%. The number of active cases has stayed flat at about 1,400. These slight decreases in our numbers are encouraging, but we are still at a critical state in our community. Christmas is less than 2 weeks away, and we encourage you to please take this into consideration as you make your plans. The especially good news this week is that we received our first round of COVID vaccine yesterday, and we have begun sharing these first doses to our frontline healthcare workers in our community. Dr. Schultz shares more about this process.
Hi, good afternoon. I'm Dr. Doug Schultz. I'm the Chief Medical Officer of Shannon Clinic, and I'm proud to say that Shannon was named one of the few hospitals in Texas to receive this initial dose of the Pfizer COVID-19 vaccine. Actually, there's 23 hospitals, so we were one of those 23. So we have gotten our first shipment of 1,950 doses, and those doses, according to the state and the CDC, are to be given to providers who take care of patients in this first round, and then we'll start getting shipments on a weekly basis, and we start doing everybody pretty quickly. Also, in this same group are long-term health people in long-term health facilities. They are partnering with CVS and Walgreens to get their vaccine that way. So they'll be taking care of this first round. Also, we're going to take care of our first responders, EMTs and police officers, and also our regional partners that are in this region. They're hospital personnel. So they'll all be taken care of in this first round. There.
More of that vaccine should come every week. We should get another supply. So hopefully next Monday we'll get another round, and that'll continue. And hopefully it'll be even more doses as it comes. Now the other vaccines coming online as well. Moderna vaccine may be approved this week by the FDA. Then it will also be available for use, and we would use it as well. There are side effects, but they appear to be mild this time. So they're like sore arm, fatigue, maybe a little bit of fever, weakness, but very limited, really 24 hours. And this vaccine takes 2 doses. So this is the first dose today. So the second dose is 21 days from now. The first dose provides about 50% protection, probably after just a few weeks. Then the second dose provides 95%. These physicians volunteer because they want to get the message out that they believe these are really smart guys, and they've studied all the data that we have on this vaccine, and they feel like it's safe. And they want that message to go out to everyone, because we know there's a lot of people that are on the fence about getting this. So we want to get the message out, hey, these are some of the smartest people around here, or probably anywhere, and they think it's safe. So that's the message we want to get out. Vaccines only work if a large number of people take them. That's the way they knock out any infection. If just a few people take them, it does not work. So we need large numbers of people to get this vaccine, and then it will really take care of COVID.
We have received many questions about when the vaccine will be available to the public. We don't have the answer to this yet, but we expect to receive more vaccine shipments, and we will continue to make these available following the CDC guidelines. Long-term care and nursing home facilities will be partnering with CVS and Walgreens to begin receiving their vaccines next week. As we know more from the CDC and the state, we'll be sharing this information with you, and we'll update the information on our website. Thank you, and stay safe and healthy.